Hi there. This series of videos is designed to enhance your capacity to deliver high-quality serious illness communication. In it, we introduce clinical tools and implementation strategies developed by the Serious Illness Care Program at Ariadne Labs, a joint health system innovation center at the Brigham and Women's Hospital and the Harvard T.H. Chan School of Public Health. In a prior video, we discussed the importance of serious illness communication and evidence that links a communication-focused care delivery model, the Serious Illness Care Program, to outcomes that support the quadruple aim of healthcare. In this video, we'll demonstrate use of the Serious Illness Conversation Guide and introduce a structured approach for serious illness conversations. Let's get started. Mr. Jackson is a 68-year-old retired married salesperson with advanced chronic obstructive pulmonary disease on oxygen and steroids, type 2 diabetes, chronic kidney disease, and chronic hip pain. He has had 3 hospitalizations this year, multiple stays in subacute rehab, and 2 ER visits. He has been experiencing worsening shortness of breath, increasing fatigue and weakness, worsening functional status, and a 10-pound weight loss. He is scheduled for a telehealth visit following a recent hospitalization. Mr. Jackson will be seeing Dr. Fromey, his primary care physician. Today, Dr. Fromey has planned to have a serious illness conversation with Mr. Jackson. Mr. Jackson was informed in advance that part of the focus of this visit would be to talk about Mr. Jackson's goals and priorities. Dr. Fromey's goals for this conversation are to ensure that Mr. Jackson understands what may be ahead in the setting of his existing medical conditions, and to explore Mr. Jackson's goals, values, and preferences for care in the future. To do so, he's going to use the Serious Illness Conversation Guide. Let's take a look at Dr. Fromey's conversation with Mr. Jackson.
Hi, Mr. Jackson. It's good to see you virtually like this. How are you? How are you feeling?
Hi. I've been better, but I'm feeling good. I'm out of hospital, and so that's good.
Yeah.
So overall, I'm doing all right.
Amen. Well, and then how was it being in the hospital this last time?
I didn't like it. I just didn't like being there. People are fine, doctors, nurses.
Yeah.
But I'm not complaining too much.
That's fair. Well, listen, I'd like to talk about what is ahead with your illness and have us do some thinking in advance about what's important to you so that I can make sure that we provide you with the care you want. Would that be okay?
Oh my, let's see. Could we maybe wait on that a little? Maybe a little later. Okay.
We could. I would like to talk about it today. I am trying to do this with all my patients, and I like to try to do it at a time when they're actually feeling better. And because it's hard to have these conversations, when you're feeling really sick.
Right. That makes sense. Okay.
All right. Thanks. Well, so my first question is what is your understanding now of where you are with your illness?
Well, I have bad lungs, and they're not going to get better. I just hope they stay the same, maybe. But that's what I got. I got bad lungs.
Yeah, fair enough. Well, how much information about what is likely to be ahead with your illness would you like from me?
Everything. Yeah.
Okay.
Yeah.
Well, then I want to share with you my understanding of where things are with your illness. I'll say it can be difficult to predict what's going to happen with lung disease. I hope that you will continue to live well for a long time. Like, that's the goal. But I'm also worried that you could get really sick really quickly. And I think it's important to prepare for that possibility.
Oh, man. You mean like, you're talking about if it gets worse and stuff, huh?
Yeah.
Oh, brother. Wow.
This is hard to think about and hard to talk about it.
Yeah. But we got to do what we got to do. We got to talk about it. So okay, I'm game.
All right. Well, I appreciate that. Um, what are your most important goals if your health situation worsens?
What do you mean? Like, uh,
Well, for example, for some people, their work is their most important thing.
oh yeah, 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 yeah. Uh, uh, my family,
Hmm.
my family.
Yep.
Uh, if I had to say, I guess number one goal, see my grandson graduate from high school. He's supposed to graduate next year.
Oh, that's wonderful.
Yeah,
Wow,
he's
that's
a
huge.
good boy. Yeah, he's a good boy.
Yeah. Yes. So that's exactly what I'm looking for. Well, and then what are your biggest fears and worries about the future with your health?
Um, having my wife see me suffer, I've
Mm,
been thinking about that a lot.
mm.
And I'm not looking forward to suffocating. You know?
All right.
Yeah,
That's fair.
yeah.
Actually, you're, it's great you still have your sense of humor. I would like to come back to that subject later because I think there's a lot of things that we can do to put a plan in place to really help prevent you from feeling like you're suffocating. But
Okay.
do you mind if we kind of finish this line of questions first?
Sure, that's fine.
Okay, great. What gives you strength as you think about the future with your illness?
I look to God as I lead my life. I'm not a big churcher, but I do look to God, and that helps me.
Hmm. Yeah, that's that's wonderful. Well, and then what abilities are so critical to your life that you can't imagine living without them?
Like what? Like
Well, a mentor of mine, her father told her that as long as he could sit in his easy chair, watch football on TV, and eat chocolate ice cream, then he was good.
excuse me. Yeah, I like that. That's funny. Yeah, I see what you're saying. I I would like to be able to take care of myself. I mean, physically take care of
Hmm.
myself,
Yeah,
by myself, like a bathroom and wash myself and stuff. That's a big thing for me.
yeah, yeah, that makes sense.
Yeah.
Well, if you became sicker, how much are you willing to go through for the possibility of gaining more time?
Oh, you mean like what kind of medical stuff I would be willing to
Yeah, for
have?
example.
Yeah, right. Uh, well, that's a tough one because a couple of times ago, as you know, I was in the ICU, and I don't know that I want to go through that again.
Hmm.
But at the same time, you know, I got out of it, so I'm not sure. That's a tough one to answer.
Yeah. Well, actually, just me hearing that you've had that experience and you're a little bit on the fence now is really helpful. I don't think we have to make a decision about that today, but it's really helpful for me to know that about you.
Okay, good.
How much does your family know about your priorities and wishes, the stuff we've been talking about?
You know, that's a good question. I've tried not to, upset my wife, and even my kids. They're adults, they're all, but I don't want them to worry too much, so I haven't really talked about it with them.
Hmm.
Yeah.
Well, let me see. Let me try and summarize what I heard you say, and you can correct me if I get something not quite right. But um, what I heard you say was really the important things for you are your family, seeing your grandson graduate from high school, not seeing your wife see you suffer, that it's important for you to feel like you can take care of yourself physically, and that you've had this experience of being in the ICU and are not decided yet, maybe about whether you'd want to go through that again.
Yeah.
I think keeping all that in mind and what we know about your illness, I'd recommend that we have another one of these conversations and maybe bring your wife into the loop. What I'm thinking is one way that we can make this easier for her and both of you is really to have her hear kind of what's important to you and what the plan is, so that when things happen, she doesn't panic. And I think that'll really help us make sure that your treatment plans reflect what is important to you also.
Mm.
How does that plan seem to you?
You know, that makes sense to me, doctor. I think it might help her. 'Cause I think she would like that.
Good, good. I'm glad to hear that.
Yeah.
And I want you to know I'll do everything I can to help you through this.
Thank you. I appreciate that.
Yeah, you're welcome. So I'd like to come back to the.
Take a moment and reflect on the conversation you just watched. What's one thing that you didn't like about the conversation, or that felt different from what you would typically do? Take a moment to write that down. Now, write down one thing that you liked about the conversation and might imagine using yourself. The Serious Illness Conversation Guide provides a framework for best communication practices in the setting of serious illness. It was developed with iterative feedback from patients, families, and clinicians from many disciplines and specialties. It has been used and tested in settings all over the world. Over the next few minutes, I'll show you how it works and why. First, I'm going to give you a high-level overview of the guide in 3 parts. Then we'll look at the individual elements within those parts. Using a communication guide can feel awkward. After all, we spend our whole lives talking. You might find yourself saying, "That feels awkward," or "I wouldn't say it that way." It can be helpful to think about the analogy of making a pie for the first time. You may bake all the time, but the first time you make a new pie recipe, you're very likely to stick to it. Exact ingredients, precise steps. It may go great the first time. It may not. Over time, however, you may begin to experiment, to find that you have particular ways of doing things that work well for you. That whole process is in service of making the best pie possible. We ask you to try becoming proficient in the use of the guide as it's written. Most find that these exact open-ended questions make these conversations more efficient and effective. Over time, you'll find ways of making it your own, and that process will be in service of delivering the best serious illness conversations. In clinical medicine, we are taught to follow a patient's lead in conversations. This is a conversation with an agenda. The agenda is to learn how best to care for your patient when they face decisions about treatments for which there may not be clear benefit. The first part of this conversation is setting it up, assessing what a patient knows and delivering a patient-centered prognosis. Setting up the conversation builds trust, helps patients feel in control, and allows the conversation to begin gently without scaring the patient. Assessing illness understanding and information preferences gives you an idea about how much you need to share and how that information should be shared. Delivering a patient-centered prognosis helps establish a shared context in which to think about what matters most. It's likely that the patient is hearing a direct, honest prognosis for the first time. This is a moment to take a breath, to pause and respond to emotion that you see. Delivering prognosis is hard, so it also gives you a moment to recover from doing something really difficult. The third part of the conversation involves exploring patients' goals, fears, and strengths, as well as those abilities that people feel are critical to their quality of life, trade-offs they might consider for future treatments, and the awareness of family members about what matters most. The conversation closes with a recommendation for the way forward and an affirmation of your commitment to the patient. And that's it. Simple, right? Now let's look at these 3 parts in closer detail. Setting up the conversation involves introducing the idea, asking permission, and if necessary, describing the benefits of these conversations. If a patient is resistant or asks you why you want to have this conversation, you might say, "I try to have conversations like this with all my patients so that I can make sure I provide them with the best care possible." When you assess illness understanding and information preferences, You learn how much information you need to share and how a patient desires to hear it. If you share information that a patient is not prepared to hear, there is a good chance that they won't hear it. Furthermore, when you ask a patient what information they want to hear from you, it enhances their control of the conversation. When they tell you what they want to hear, it should give you confidence to move forward with sharing what you know. Prognosis can be delivered in different ways. When we think about prognosis, we typically think about how much time someone has left. Providing a time-based prognosis as a range reflects real-world uncertainty and builds trust, whereas giving a single time point, say 6 months, undermines trust because they know it's almost never exactly that. Time-based prognoses can be very useful to patients and are often sought by patients. You might say, "I wish we were not in this situation, but I'm worried that time may be as short as months to a year." For some, understanding what life may be like is more useful. A functional prognosis focuses on what type of functional outcomes they might expect as illness progresses. You might say, "I hope that this is not the case, but I'm worried that this may be as strong as you feel, and things are likely to get more difficult." Finally, it may be useful to provide a prognosis that balances genuine uncertainty about the trajectory of illness with the genuine possibility that life could end abruptly. This helps people prepare just in case. You might say, "It can be difficult to predict what will happen with your illness. I hope you will continue to live well for a long time, but I'm worried that you could get sick quickly, and I think it's important to prepare for that possibility." These kinds of prognostic communication allow you to share information with the patient about what may be ahead in a way that meets the patient's needs. For this reason, it may be useful to provide multiple types of prognosis. Following the delivery of prognosis, it's important to take a breath. You've just done something difficult. Sometimes patients are expecting what you said, and sometimes they're not. Regardless, it's helpful to pause and respond to emotion with silence, acknowledgement, or exploration of their emotion. Delivering prognosis is hard. It can be helpful to have a way out of what can be a difficult moment. Asking about what matters most to patients is a great way to do that. All patients have goals besides living longer. Understanding them helps you tailor recommendations to address their priorities. In clinical medicine, we're often focused on fixing things, but allowing patients to express their fears and worries is actually therapeutic. Sharing them helps patients feel less isolated. We often focus on what makes illness hard for people, but people bring a variety of cultural and family assets to their illness experience. Knowing what these are helps us help patients activate these. Asking about them helps patients feel known and understood. People have abilities and pursue activities that they might imagine struggling to live without. It's important that we understand what these are, precisely because some of the treatments that people with serious illness might face can limit their ability to do some of the things that they most value. People are often willing to go through a lot to get better or have more time, but many will have limits based on their own or others' experiences. Our understanding what these limits might be helps us contribute to the shared decision-making process. Furthermore, asking this question establishes the frame that every decision has trade-offs. It's important to note that not every patient will have a clear answer for these questions right away. It's unlikely that they will have ever been asked these questions before. For this reason, you may need to provide examples to give them a better sense of what you mean. When thinking about important abilities, you might say, "Some of my patients have told me that eating is one of the things that gives them the most pleasure, and they would really struggle if they couldn't eat. For others, being able to watch their favorite TV shows is good enough." When thinking about trade-offs, you might say, well, some of my patients have told me that they would not want to have CPR or intensive care if they became so sick as to need that. Others have told me that they would do anything possible to live as long as possible, even if they were likely to experience significant discomfort and uncertainty about whether they would survive. Family support, when possible, is critical in serious illness, especially as a person's illness progresses. Understanding how much family or friends know about a person's priorities and wishes can help you understand what their support system is like and how it may need to be activated. Having shared and elicited important information, it's critical to follow it up with a recommendation. Patients want our recommendations and often ask for them. A recommendation has a few key components. First, it's helpful to summarize what you've heard the patient say about his or her values and goals. You might say, I've heard you say that spending quality time at home with your family is your most important goal if time is short. It can be helpful to acknowledge again the prognostic context in which those goals have been expressed. You might say, given what you told me and what we know about your illness, I recommend that we set up a meeting with our palliative care colleagues to help ensure you have the best treatments for those symptoms that you are worried about. A recommendation does not have to be a medical decision if that is not appropriate. It could be a recommendation to revisit the conversation in the future or to discuss with family. If the patient is ready, it could be a recommendation for hospice, to complete a POLST form or a DNR order. It also does not have to be an end-of-life decision. For example, one oncologist colleague of mine, in using the guide, learned that her patient with advanced cancer is passionate about biking. It's the way he gets around and sees friends and family. He said that he would struggle if he couldn't bike. This led her to have a discussion with the patient about his chemotherapy and what doses and medications might minimize their potential impact on his ability to bike. At the end of this conversation, patients can feel vulnerable. They can fear that this conversation means your relationship and your commitment to them is coming to an end. Affirming your commitment to them in whatever way feels most genuine to you is a helpful way for them to know that this conversation is a sign of your commitment to them, regardless of what happens. People worry that reading a conversation guide can leave them sounding inauthentic or uncaring. Using this conversation guide is most effective when you remember to actively listen to your patient and respond in ways that are authentic to you. Several communication behaviors, all of which you may typically do, can ensure effective, efficient, and compassionate use of the guide. For example, you can ask for permission, several instances of which are built into the guide. It's important to respond to emotion when you hear it. One of the most effective strategies is to name it and explore it. You might say, I can see that you're feeling sad. Tell me what you're thinking about. Another is to use silence, which is a powerful form of nonverbal empathic communication. You can and should ask clarifying questions to make sure you've understood correctly and fully what you've heard. Finally, you can use what we call bookmarking statements, which are those statements that allow you both to acknowledge when you've heard something important that requires more conversation and allows you to move forward through the guide so as to get the fullest sense of what to focus on. For example, you might say, in response to an answer about fears, it sounds like managing your pain is a major worry for you. I think we should spend some more time talking about how we can effectively manage your pain. Would you mind if I ask you a few more questions and then we can come back to that? This gives you the chance to understand the full range of possible topics for further discussion so you can prioritize as you go. This video introduced you to the Serious Illness Conversation Guide, a structured approach to serious illness conversations that are patient-centered, efficient, and effective at helping patients understand and share information that can make an important difference in their care. Thank you very much for watching. We encourage you to watch the next video in this series in which we talk about building these conversations into your practice.